Well, hello, everyone, and thank you for joining the Alliance for our second webinar of a two-part series on direct primary care. I'm Elena Cambizzi. I'm the Senior Vice President of Business Development and Strategic Marketing here at the Alliance. So some housekeeping things to keep in mind. You're all muted and you're on mute mode, and if you have any questions during the webinar, please send them in the chat box. If you want to say something or respond to someone during the discussion, please raise your hand so that the little hand icon, as shown here on the slide, shows a green arrow pointing up. So now I am proud to introduce our presenters, and we're very pleased to feature three employers that are clients of the Alliance Cooperative. Dan Ludwig is the Director of Benefits and Safety at Brakebush Brothers. Dan has deep roots in managing safety programs with over 20 years of experience in loss reduction. Under Dan's watch, Brakebush Brothers have seen a 75% increase in occupational incident rates. And in 2014, Dan took on the Benefits and Wellness Program and shifted his focus to also reducing Brakebush's healthcare spend. So Brakebush has since opened an on-site clinic offering primary and acute care, offering a robust musculoskeletal injury prevention program, on-site imaging, on-site mental health services that Dan will talk about with us today, and he's planning to expand, a Centers of Excellence program, strategies to reduce prescription costs, and many other programs. Remarkably, Brakebush has not increased premiums for its employees and their families for 5 of the last 6 years. As a result of Dan's direction, Brakebush was awarded the Alliance Healthcare Transformation Award in 2018, and then in 2019, the Employer Purchaser Excellence Award by the National Alliance of the Healthcare Purchaser Coalitions. He was recognized in that event alongside giant corporations like Disney. Next up, Tena Hoag. And Tena, thank you so much for teaching me how to properly pronounce your name today. Tena Hoag, CFO at Advanced Lasers. Tena is the CFO at Advanced Laser in Chippewa Falls, Wisconsin. She has spent more than 20 years in highly regulated manufacturing operations and deeply believes, she's passionate about her belief in that manufacturing workers are the lifeblood of the American economy. This belief is what pushed her in recent years to learn more about healthcare to help her create better plans for care for those around her. Tena has an M.B.A. From UW-Eau Claire and serves on a variety of nonprofit boards, including Junior Achievement, CVTC Foundation, Women's Business Center, and the Chippewa Falls Industrial Development Corporation. Jake Nolan is the Director of Human Resources at Rice Lake Weighing Systems. Jake Nolan joined Rice Lake Weighing Systems as a Director of Human Resources in 2011, and in his role, he focuses on providing high-value healthcare at his company. Prior to his current role, he served as a human resources leader at Fortune brands such as Newell-Rubbermaid and GKN. Jake holds an incredible pedigree of degrees, an M.B.A. in Human Resources Management, Master's degree in Business Law, is certified as Senior Professional in Human Resources. He's a Master Trainer for Mission Directed Workteams, and he's also a Master Facilitator for Investment in Excellence and Thought Partners for High Performance. That was a mouthful, Jake, but it's so good to have you with us. Jake joined the Alliance Board of Directors in 2020. So these panelists will discuss how and why they got into direct primary care, and we'll talk about their blueprints for success in establishing their own on-site and shared site clinic. They will also answer as many of your questions as we have time today. This will be formatted as a panel. It's a question and answer session. And thank you, of course, to everyone who submitted questions beforehand. Thank you to our three incredible panelists. And so let's begin, shall we? Jake, Dan, and Tena, these first few questions are opening questions They're about your decision to offer direct primary care at your company, and of course, also discussing your journey. So I will ask the same question of all of you. Let me start with Jake. Jake, what made you decide to start an on-site clinic at Ice Lake Wellness System?
Money. It was a cost factor for us. We were facing a 30% renewal, which would be about $2 million additional a year, and this was 5 years ago. And so decided to start our strategic plan that we wrote about 8 years ago. And one of the facets of that strategic plan was some kind of clinic or health center. It was one bullet point because we didn't know very much about it. Now, 3.5 years in, I would say that our health center is the focal point of our health strategy, healthcare strategy. It links everything else together, from being self-insured to our plan design and steerage, to the contracted care that we receive through the Alliance, our other partners like Aletheus for transparency. Certainly it is our wellness focal point, and they also help us with healthcare consumerism. So really the red thread that runs through our entire health and wellness program.
Thank you. Tena, same question for you?
Sure. We weren't necessarily facing any sort of crisis like some other businesses have in the past. But one of the things that I found when I came here is you hear nothing about else but how costs are skyrocketing. Well, for a number of years in our self-insured world, we were getting a 0% increase, a 2% increase. And so although you don't have a whole lot of data as a fully insured company, the fact that we were getting such small or no increases certainly led us to believe that we were ultimately being taken advantage of. And if the self-insured companies were willing to do it for that, we knew that we could do it for a lot less. So that's what sort of led us down the path to exploring what other avenues do we have, what would be a good way to set out over several years. So the clinic seemed like a natural start.
Thanks, Tena. What about you, Dan? And I know you've gone through a couple of iterations of an on-site clinic offering.
Yeah, for us, it's similar to many others. We're facing year after year of double-digit increases in our premiums. And so in 2014, we made the decision that we wanted to take control of it, and we moved over to a self-insured platform from fully insured. And at that point, then we looked at, okay, what is our strategies now? Now that we're self-insured and we've got some access to some better data and we can have some control, what are we going to do? And prior to that, back in 2007, we had started offering MSK prevention program, musculoskeletal injury prevention program that was aimed largely at occupational concerns, but also for non-occupational. And we had great success and said, if we can have success providing on-site services for soft tissue injuries, we can probably have additional success by looking at primary care. So after we went through and the dust settled with self-insured, the next step really was how can we expand services that we offer on site, and the logical solution was to provide an on-site clinic.
So then,
which we started in 2016.
I apologize, I thought the word. Any internal hurdles in establishing a clinic?
So the biggest internal hurdle, obviously, is the cost. But with those increases that we had seen, the leadership within the company was ripe for change. They recognized that we couldn't continue to do things that we had done before. So when we looked at what would it take to get a clinic started, but then compare it to the return that would be expected from a clinic, it made the sell a lot easier.
Tina, same question to you. Internal hurdles?
Sure. So I think our primary hurdle was that our ownership always wanted to take care of the employees. And I think some folks felt like going down this path was sort of getting up into people's business, and culturally that's just not who we are or who we were. And so there was a little bit of difficulty selling some of that internally. And we knew that the culture change would take time. So we actually started our clinic a year before we even went self-insured. So the first year was, for all intents and purposes, basically a cost into the business, but we knew it was going to be a several-year model to get us to where we wanted to be.
So Jake, for you, a slightly different question, but along the same lines, how did you get your internal leaders on board with this idea?
It really came from our president, who, we're privately held and have a passion for taking care of our employees, and he was frustrated with the healthcare system, and he said he wanted something approximating old-fashioned healthcare, where your provider knew you and they would spend more than 10 minutes with you and they didn't get a bonus for it. And so we really needed to get him on board, and that wasn't too difficult. I think the most difficult thing, though, is getting a commitment for 5 years or more. It's a big investment in both money and time and effort to put a clinic together. So you need to be committed, and if your CFO is a one and done kind of person, and oh, hey, this didn't pay off this year, we're going back to what we did before, and fully insured, it's not even worth the effort. So 5 years or more, and remind them when you have a bad year of the other good years, and you'll be okay.
That's a great answer. Thank you. And Jake, I'm going to stay with you. How did you choose your partner, and why? And maybe if you can tell us who your partner is, meaning is it a local provider, a national vendor, an independent physician? How did you make that decision?
Yeah, and that's been a little bit of a journey for us. And originally, we interviewed a number of different third-party clinic providers, and we started out with Care Here. They're based in Nashville. At that time, they had about 300 clinics around the country, and we assumed that bigger was better. And as it turned out, it didn't work out well for us because we wanted to do things that were not within their boilerplate. Things that we thought would be obvious, like childhood immunizations, seeing children under 2 years of age, and just things that we didn't know to ask those questions. So it just wasn't a good fit for us. Last year, we made a change and went to an organization called Neopath Health out of Minneapolis, and they are a much smaller regional third-party clinic provider. I believe they're up to 10 sites in Minnesota. We were their first in Wisconsin. They're working on a couple of others. But they're really, they understand us and they listen. And when we say, hey, we'd like to do this in our health center, they say, okay, how do we make that happen? So it's been fantastic, just night and day difference in the last 8 months, 10 months.
And so, Jake, you mentioned it, and I should have asked everybody, and I will now. So your employees and their families can participate in this on-site clinic offering, right?
Yeah, it's available to everybody who's on the Take Control of Your Health plan. So all of our employees and their members, and there is no charge for anything at our health center. So from prescriptions to office procedures, to office visits, to wellness visits, referrals. Anything that gets done in our health center is no cost.
Thank you, Jake. Dan, you've had a similar experience. Do you mind taking us, and I don't know, we've been talking for a little while, so how did you choose your partner for your clinic? And you've done a couple of iterations as well, so could you tell us your experience?
So similar to Jake, we're not with our original partner. Our original partner essentially was handed the business because we had a long-term relationship with them already for our wellness program, and they also did clinics, so it seemed like a natural fit at the time. And what we discovered after we were about a year into it is similar to what Jake said. They had kind of a boilerplate of this is what we offer in a clinic, and there were things that we looked at it and said, well, we want to be able to offer these other things as well. And it just didn't fit. And we're not suggesting that our way was right and their way was wrong. It was just a matter of it wasn't just a good fit. And that's one thing I encourage anybody that's considering going into a clinic is to talk to others and say, well, what do you like to offer in a clinic? And then when you're developing your RFP, make sure that you ask the right questions that will lead to, are you comfortable with this service within your clinic? And so we went through an RFP process last year, and we selected Proactive MD, and they took over March 1st, which of course is an interesting timeline because COVID pretty much hit right as they were taking over. So there's been a very steep learning curve. We've got to know each other very quickly because we had a chance to, just as they're coming on, deal with a bunch of COVID situations, which they're able to help us through. So Proactive MD it's been a short relationship, but has proven to have been a positive change for us.
Thank you. And Tina, your experience is slightly different, so maybe you can tell us your experience.
Sure, absolutely. So 2.5 years ago, when we started down this path, we're a small employer. At that point in time, we weren't probably much over 100 employees and maybe 65 of them on our health plan. And so we didn't necessarily have all of the same options as some of our larger local businesses may have had. So we had to think a bit differently. We did interview some independent operations, but with our size and with our somewhat more limited budget, we ultimately ended up in a shared clinic situation where when we started, there were 3 local businesses, us included, that ultimately ended up opening the clinic together. So a very different model, but I think that just underscores one of the things that I say a lot is you do have power regardless of your size. Sometimes you just have to find those like-minded people to take advantage of things that the larger organizations can do by themselves.
So interestingly, as we were speaking, a question came through, and if I could ask our director of marketing to take me to that question because it's very salient. So the question is this on-site, shared site, DPC? I know we're using a lot of terminology, and so just for our audience, so both Dan and Jake have an on-site clinic, and Tina, she just said she has a shared, her organization is offering a shared site clinic. The direct primary care clinic is different in the payment method, and so this is really the gist of the question. Are you being billed a fee for service, or are you paying one monthly fee that includes all visits, or is it a PEPM or a PMPM model? Because we've seen all of them. So let's answer that before we continue. Dan, may I ask you, how do you get billed?
Who are you starting with?
Oh, sorry, Dan. I apologize.
Okay, so ours is a set monthly fee that covers the vast majority of services. The things that would be in addition to our monthly fee would be higher cost labs and prescription drugs. Everything else is covered under one fee, whether they see one person or they see 2,000 people out there. So obviously, we want them to see 2,000 people out there. But yeah, it's one fixed fee for the most part.
Thank you, Dan. Tina?
So with our shared site situation, it's slightly different. The arrangement that we have with the provider is that the group shares a certain number of hours per week for the various types of service that we offer. So what we ultimately get charged as an individual business is our share of those hours, whatever we actually use. And then if there's excess capacity where the providers are not seeing anyone, those excess capacity hours are split by a prearranged percentage that our group came up with.
Thank you, Tina. And Jake?
Yeah, we're a little bit different. Our clinic is still private to our employees and their family members on our plan, and so our arrangement is it is all pass through, and so we pay an administrative fee to Neopath, and then all the costs of the clinic are completely transparent and passed through to us, and they pay them and we reimburse them. And so everything from prescription drugs to hazardous waste pickup to the internet and all those things, we pay for it all, including the salaries of the 6 clinic employees.
Yeah, so the point is that there is a lot of different methodologies or payment methods. And in transparency, the Alliance, our friends in the audience have heard me say before that we have chosen a vendor and we will be bringing DPC to the Madison market to begin with. So in full transparency, Dan has chosen Proactive MD independently from what the Alliance did, and we've chosen Proactive MD as well. And the model that we will be bringing to the market is still different. It is a PMPM model, and it's a pay-as-you-go, meaning that an employer will not be charged for all of their employees on the plan, but rather as employees and their families are accessing the direct primary care clinics, that's how they will get paid. So there is definitely a variety of methods, but we are talking about, you know, I don't know if you want to call it capitation or global payment. It isn't a fee-for-service model, and that's really what makes what we're talking about different from primary care as we know it. So you are all working with different partners to set up your clinics, and we heard both Dan and Jake describing some of the initial difficulties because, you know, sometimes you start and there is fog in front of you. You don't know what you don't know. So can you tell us a little bit more about your process of onboarding these different vendors? And Jake, I would like to start with you.
Yeah, it was. I describe it as you know, I would go through the same kind of learning process that I would a new staff member in my HR or EHS department, and it's really important for the providers to understand what you're trying to accomplish, and for us, that's long-term health outcomes, and then they have to understand the benefits. And for all of our providers, whether they were with Care Here or Neopath, they have all come from large healthcare systems, and so they understand how those systems work, and we needed to explain how our system was different and what we were trying to achieve. And you know, from how do they refer if there's something that can't be done within the clinic, and then it's really important for them to understand our tiered plan design, that if they refer somebody to a tier 1, there's no cost to the employee, similar to the health center. But if they go to tier 2 or tier 3, then they are economically impacting the member. And so a lot of education, a lot of times around the table. You know, just like anybody else, they don't pick up the benefits plan and the design and the lingo and all the partners on the first time around. So I've spent hours and hours, and almost every time, every quarterly review, when I go over and meet with the staff, I remind them about it, and they have become subject matter experts.
And Jake, not only you're using the Alliance data, and as many of us know, the claims data comes first to the Alliance, so we have that good connectivity. But I also heard you say, and of course I know, that you're also using a care navigation firm. So you're using Alethea in conjunction with the Alliance data and in conjunction with your on-site clinic. So I guess my question is, so your on-site clinic is well connected with Alethea. Am I accurate in what I'm saying?
Yeah, actually, that's all of our referrals out of the clinic go through Alethea, and what they do is they provide the different options for Tier 1, Tier 2, and Tier 3. Tier 1 and Tier 2 are both networks provided by or through the Alliance, and then our Tier 3 is our old PPO plan, and so Alethea is helping us with consumer education. Here are all your options, and they will, if it's location that matters to them, if it's the provider system that they're in that matters to them, they can get them all the information that they need to make a good decision. And I'll say well over 95% of our members are going to Tier 1 and Tier 2. The unfortunate part is Tier 3 includes Mayo, and they account for about 65% of our spend.
Yes, indeed, they do. And Jake, just for our audience, then Alethea and the Alliance are connected, integrated from a data perspective, and so Alethea understands the cost of the contracts. So and they know the benefit, and they also know the cost of the providers from as contracted by the Alliance, and that helps them and helps your employees guide them to the most cost-effective physicians. I also believe that there is quality data that they have as well. So just wanted to sort of make that point of how we're all interconnected to best service our patients. Tena, may I ask you the same question? How did you onboard your vendor, and how do you know, how are you finding out what their capabilities are and how they're matching with your needs?
So ultimately, we did not end up going with an independent operation. We are actually with a system. Definitely one of those things that a lot of people have cautioned me against, but it has worked out well for us so far. They've been very receptive to really the vast majority of anything that we have brought to them. And the way we find out if they can do it is we ask and continue to ask, and then help them figure out how they can help us help our employees. There were a fair amount of bumps and bruises in the beginning. That has all pretty well settled out, but there are a lot more that folks maybe don't realize matter. So it's quite a process. It's a journey. I don't think we will ever be done making tweaks and improvements. And so the important thing is to find someone who has, as you mentioned earlier, that flexibility and that willingness to try to be in it for the right reasons.
Tena, you have a shared site clinic, so there's other employers that have come together. So you've come together with employers in your community to do this offering. How did the employers, how did they get together? Because like you, many of our clients, many of our employers are smaller, so they cannot necessarily afford to, on their own, build an on-site clinic. So just wanted to hear your process of bringing employers together.
Sure. So early on, we had some local people who were helping to make me smarter faster. And so you start getting into these circles. I'm going to call them circles of influence. And you learn a lot. You get introduced to a lot of people. And if you are inquisitive and innovative, the connections start happening from there. Now, if you're, and that helped me get introduced to a lot of different possible providers or accessories, if you will, to the rest of the clinic. We found, though, the other businesses, simply by being involved in our community, as simple and easy as that sounds, you attend the same chamber events or the economic developments or some speaker series, and that's where you meet others who care about the same things that you care about, and the conversation stemmed from there. And so the first person I ended up connecting with was Spectrum Industries, also here in Chippewa Falls. And lo and behold, found out that she and I were researching the same sorts of things at the same time. And so we just developed a friendly relationship that sort of started us down this path. And when we ultimately were vetting out providers, we found that another large business in our area, Great Northern, was looking to add something to their Chippewa Falls location as well. So some of it was almost a little bit accidental. I think that our local chambers and EDCs could really support this effort in helping people meet one another if it's not something that has happened to you organically. I know I've been speaking at a handful of those events and trying to bring others kind of into this fold, because we all, I am very pleased with the businesses that we've been able to partner with, and how they're looking for betterment of the whole community, not just our collective band of employees.
Thank you, Tina. And then I'm going to go back to how are you working to onboard your vendor? I know you're in the middle of doing exactly that right now.
So one thing that helped us tremendously is we were able to keep our existing providers out there. We just changed vendors. So from that standpoint, it was very smooth for our employees to keep the existing providers. And they've been with us now. Terry, I believe, has been with us for over 2 years now. So he's learned the ins and the outs of it. And one thing that I think that Proactive did better is really try to learn our system and talk with how we want to do things, you know, as far down as if you've got an occupational injury that they're going to deal with at the clinic as opposed to a personal health condition. What are the forms that are going to be used, and how do we handle it, and who do we talk to? So they had a process established for onboarding themselves, so that they could improve the processes that the providers were doing. And then, of course, like I mentioned, we really increased the relationship by having a COVID happen at the same time. So we got to learn each other quite a bit and talk through some of our concerns on both ends.
So I asked Jake that question earlier, but I didn't go through to ask Dan and Tina. So who is utilizing the clinic? Is it employees or plan participants, children? So Tina, may I ask you that question first?
Sure. So every employee of Advanced Laser, regardless of their part-time, full-time status, has access to our clinic, and then all covered dependents. So dependents only if they're already signed up for one of our medical plans.
And you said before the size of your employee, how many, I'm sorry, I'm not saying it right. How many employees do you have on your plan right now?
There's I want to say around 85 families in total.
And Jake, you as well, how many folks on the plan?
There's about 400 employees and about 900 members total.
Thank you. And so Dan, back to you then. Same question as Tina. Is everybody who can actually use your on-site primary care clinic?
So similar to Tina, all employees, regardless of whether or not you take our coverage or not, and then all covered spouses and dependents can utilize it as well. And it's the same deal. Where our goal is to have everything free at the clinic. We do have about 10% of our employees that chose a high deductible health plan, and the IRS gets their say in what we can provide for free and whatnot. And so we make sure we draw the line in the sand and say, okay, this you can do for free, and this you have to pay. And we try to make sure we keep those costs as low as humanly possible.
Yeah, and then I'm going to absolutely get next to the services offered, but let me ask you first the same question. How many families, how many people on your plan?
So just in Wisconsin that would have access to that, you're about 750 to 800 employees, and I want to say approximately 1,300 members.
Yeah, so for the folks that are asking this question, and so you see me sort of going back and forth because there are questions that are coming in as we're speaking. So for folks that are asking this question, clearly Brakebush and Rice Lake Weighing Systems, much larger than Tena's, and ergo Tena's decision and Advanced Laser decision to go at it with other employers, which I think is a great innovation, absolutely. And quite difficult, actually. Tena made it sound very easy, but quite difficult to do, to get employers together that are like-minded and agree. And that's what we hope that we bring to the market with the Alliance. So let me get into services offered at your clinics. And I'm going to start with Jake. I haven't heard from him for a while. So what services do you offer at your clinic, Jake?
Yeah, just before I get into that, 2 points of clarification. Our clinic is actually near site. It's about a mile from our facility, and we bought a relatively new dental office that was available, and we retrofitted it into a 3,200 square foot clinic.
And was the reason that you wanted everybody to have access to it, not just your employees?
Yeah, it was a timing thing, and we didn't have a lot of available space on our campus, and we wanted to do it the right way, and we didn't want to put it in a closet or buy a trailer or do any of those things, and so we decided to have a near site. In hindsight, it has worked out tremendously well. Gives people a sense of privacy when they do go there. It also keeps, maybe family members when they're coming, if you have an on-site clinic and they come to use it, oh, let's go see mom or dad, while we're here. And so I like it, and it's worth the, the couple minutes of inconvenience. So as far as our services go, obviously primary care is one thing, but they also do acute care. They will do some minor, stitches and getting particulates out of the eye and those kinds of things. Chronic disease management is a very big thing for them, and I would say when we went through the COVID lull, our utilization went from 85% down to about 30%, but our providers were using that time to do a lot of telephonic contact with those people with chronic diseases. Wellness is huge for us. We have an incentive plan where if you just have one appointment a year, and we call it a demographically appropriate wellness exam, which means that a 20-year-old male has a different exam than a 55-year-old female. And our care here was all about health risk assessment, and we bought into that, and so everything was about the blood test. Neopath has a different approach, and they more tailor it to the participant rather than to the to the boilerplate. So a lot of wellness visits. Obviously, we have a 125 drug formulary. Formulary dispensary. in our clinic, and so a lot of prescription drugs that can be picked up there, no cost. We are fortunate that we have a DNP and we also have an MD, and they will both do in-office procedures. So they will remove skin tags, they will do injections, they will do trigger finger release, a lot of different things that would cost thousands of dollars at Marshfield or Mayo. So it's nice that they're willing to do those there. And then obviously they do referrals for both medical and mental health. One thing that we do not do in our health center is OCMED. We do pre-employment drug screens and we do pre-employment physical, but we do not do any workers' comp. We have decided to keep that separate, and so we have a separate contract for workers' comp related injuries with another healthcare provider in the community.
Thank you, Jake. Tena, your turn. Services in the clinic?
Sure. So we have a PA, and he's doing many of the things that Jake mentioned, although perhaps not some of the things, you know, like the trigger finger release. But he's doing all of your normal primary care things, some smaller procedures, stitches, those sorts of things. We also offer physical therapy, which has become probably one of the most popular facets of the entire program. And he does work both at the clinic as well as on site twice a week. So we use him in multiple ways. And then most recently, we've added behavioral health. Because we ended up in the building that we did with the system that we did, there was space there already had behavioral health providers. So in 2020, we wove that into the contract as well. So now it's really a one-stop shop for the vast majority of any of your physical or mental needs.
And let me ask you something, Tena. Again, questions are coming in as we speak. So is there a relationship that still gets maintained with the general practitioner or the employees, patients, physician? And how is that relationship managed between the shared site clinic and the personal physician of your employees and their families?
Sure. So I think that many of our folks, once they've been up to see Brent once or twice, most often moves all of their care there. It's also the most, it's the lowest cost option and what we believe is probably the highest quality care that they're going to get locally. And so the amount of people who use Brent for virtually everything is growing. For those people who continue to use other providers, they certainly can do that. Our provider uses the Epic system for records, as does most everyone in our local area. Sometimes there are a few hiccups as to what one provider can see versus another, but we've been able to pretty quickly resolve those things. We also, even if you have a primary care physician somewhere else, and they prescribe you for perhaps a bunch of labs, we encourage folks to please don't break a relationship that you love with the provider that you have, but we can still provide you other cost savings opportunities simply by having the blood draw and the labs done at our clinic versus your home clinic.
Thank you very much, Dan. So services at your clinic?
So on the medical end, we offer your primary, your urgent care, your chronic disease management. We also offer labs, pretty much any type of lab that you can get at a normal provider we can offer here. We've got our on-site dispensary. We've got a robust musculoskeletal prevention program that they're out in the plant. They're looking at it from an ergonomic standpoint, but they're also doing surveys on a regular basis of our employees to try and pinpoint problem areas, whether we can attack it if they find a problem area in a certain department, and determine whether or not is this an environmental situation that we need to address out there, or then if they see an anomaly where you only have one person in one area with a back or a shoulder problem, they can address it as an individual. but the goal with that is to try and get that early on within the deterioration of that soft tissue before it progresses into something more severe. And then, of course, they do other things that you would typically expect from physical therapists and provide rehab for when you do have an actual injury. So it starts out with surveys and trying to address problems, progresses then to stretching and strengthening programs, and then all the way up to full-blown rehab with our musculoskeletal program. And then we also bring you on site an orthopedic surgeon once a month who can do pre and post-op consultations. He'll do injections, but then if needed, he's the one that we're going to refer out to if an actual procedure is needed. We just recently started with mental health. Started with that at the beginning of the year, and that one took off higher than we expected. We expected that there was a need out there, and it didn't take long before people were utilizing them right away. We've got a chaplaincy program here as well. We do on-site mammograms. We're bringing a mobile service to do mammograms. And we also have at-home sleep study devices that we can send people home with as well. So we've got a wide range of services that we can keep in-house. And also one other thing that I didn't mention yet, recently, later in the year last year, we started doing on-site imaging with x-rays and ultrasound. That we've got a mobile van that can come in and they respond quite quickly to urgent care situations. Oftentimes in an hour, they'll be on site to provide that service. When you consider the alternative of driving 20 minutes to the nearest ER and then waiting in their waiting room, sometimes this is actually faster for us.
Dan, same question as Tina. So the relationship of your employees and their family members to their local providers, clearly the plan allows for these relationships to remain. What have you seen, and how is your clinic connected with the local providers?
Yes, we tell people, hey, if you've got an existing relationship, you do not need to drop that doctor to come and use ours. We look at it and say, we're here to support you in whatever fashion feels comfortable for you. Whether it be all we're going to do is your urgent care, that's fine. If you want us to be your medical home, we can do that for you as well. It really comes down to the choice with the individual on what they want to do. And that's what you find. You know, you have some people that said, you know what, I've dropped my doctor and I'm going to do it here. And some their doctor has moved out of town, so it was convenient to say, well, I'm just moving my services over here. And then you've got others that say, nope, I've been with my doctor for X number of years and I really like him or her and I'm sticking with him. That's fine, and then they may utilize it for the lab draws or for urgent care when it's difficult to get into their provider. And then it's just our provider communicating with their provider to make sure that they're not duplicating efforts or stepping on anybody's toes, but that they're communicating and staying on the same page.
And I also would like to clarify something. So there was a comment that came in, and Tina, I think it was because of you said that your provider is using Epic. I just want to remind everybody that your choice of provider is a local health system. And so the question was, how can they afford Epic? But it is the local health system, and they're using Epic, and that is how they're connecting with other providers. Am I correct?
That's absolutely right.
Yeah. So Jake, I'm coming back to you. So same question. So we know you told us about how referrals to specialists are managed through your care navigation. What have you seen in terms of the relationship of your employees, their family members, of their local providers vis-a-vis the on-site clinic, or sorry, near-site clinic?
Yeah, almost everybody has because we have a female DMP and we have a male MD, and so they have that kind of choice. Almost everybody has migrated to their primary care to our health center. With regard to the relationship in the community, it's mixed. We have an imaging partner and a PT partner that we had that the Alliance assumed the contracts for, and that remains very strong, and they do direct referrals. We also are in a community where Marshfield and Mayo Clinic overlap. Marshfield has been better at recognizing our clinic staff because they all came from Marshfield. So that part has been good. In the beginning, Mayo Clinic was very difficult in getting files transferred and recognizing our health center as a legitimate, medical provider. That's actually against the law in Wisconsin. So, they are licensed practicing physicians, and all other medical facilities need to professionally reciprocate. And so we seem to have worked through that, but we have so little going to Mayo anymore. It hasn't been an issue.
And so we started this conversation by you saying, I remember I asked you what made you decide this, and you said money. So I want to come back to that and say, so through this experience, what do you think your savings have been for your to your overall healthcare spend?
I would say in 3.5 years, approaching $10 million.
I did not know that number, although we've been working with Jake quite closely for 2 years, so that's amazing. Tina, same question to you. Have you seen? I'm certain you've seen benefits to your overall healthcare spend. Have you had the data to show you maybe how much?
Sure. I can't give you sort of a long-term estimate of what are we catching and stopping from happening. But if I look simply at the care that's being provided at the clinic versus what that same care might have cost somewhere else, our savings are roughly $5,000 a month. And then keep in mind that our total spend is really sub $1 million. Just to put it into perspective, we didn't have as far to gain as some other folks. But in hard costs, I can say roughly about $5,000 a month. And the thing that makes me happiest about that, yep, $60,000 a year maybe isn't a gigantic sum, but because many of our young, healthy folks are on high deductible plans, so much of that $60,000 is money that's not coming out of the pocketbooks of my employees.
That is fantastic. Yes, thank you. Dan, same question to you. What savings have you seen over the years?
So that's been one of our struggles, is to really get a firm grasp on what is the savings. Some of it's fairly easy, and we can look at the numbers and say we're able to provide this service for this fee compared to that service for that fee. But one thing that's really been a struggle to capture is the unnecessary referrals. That is, how do you know that, hey, if somebody comes in for a back injury, the standard procedure is to order this imaging or that imaging and to do this, that, and the other thing that we know is standard in traditional medicine, but is done differently here. So we've got some estimates that look pretty good, and we try to say, okay, we're going to be as conservative as we have. But one thing is very apparent is that we, every year since opening the clinic, we've experienced a savings even compared to the numbers associated with running that clinic. And we're looking at an ROI of about 2 to 1 in regards to those costs. So it's fairly substantial.
Thank you. And actually,
if I could clarify.
Please go ahead.
So I said money, and that sounded really maybe greedy and owner-centric, and it's not. I look at the difference between where we were headed with all of our fully insured plans and the trend that we were on. And so I calculate the amount of savings between that and where we actually are. And you know, like Dan, we have not had an employee contribution increase in 5 years. So it predates our clinic a little bit, but you know, even all of our savings include all the costs of the clinic. I would estimate that for every dollar that we spend on the clinic, we get 2 back. So it's pretty substantial.
Yeah, and I was actually, I thought it was, you know, when you said money, I thought it was funny. Again, we've been working for quite some time together. I know where your heart is, and there is nothing wrong at being a steward of both your owner's bank book, right, checkbook, but also your employees. So what you're demonstrating, all of you, is that, yes, you're doing the right thing for your organization, but you're also being very responsible at providing excellent care for your employees and their families. So I didn't mean to sound flip. I thought, just knowing you, I thought it was a funny comment. So that's why I brought it back up. We are almost running out of time. So I am going to take just a very last, and then I want to see if you folks have any closing comments. One of our great broker partners, Ms. Sarah Hamas, is asking if, Dan, if you would share your partners for mobile mammogram and imaging, and maybe instead of doing it right now, you can send me an email and then I'll send it to Sarah. I am sure you're happy to share your partners, right?
Love to. Yep. Yes, certainly.
Yes, thank you. Any closing remarks, Dan? Anything we can, and I have tons of questions in front of me that we have 3 minutes left. We're not going to be able to get through them. I think we're going to have yet another session because this has been fantastic. Any last minute comments, Dan?
Other than feel free to reach out to myself or for any of us if any of the participants have any questions that you wanted answered. Feel free to shoot me an email. Love talking about this stuff. Love helping out other people that are in the same boat and trying to go down the same path. I've said it many times that, you know, one employer trying to do these strategies by themselves is going to fail. But if we get hundreds and thousands and hundreds of thousands of employers across the nation to head down this same journey, we can battle some of the national problems that we have in regards to the high cost of healthcare. But one employer is not going to change it by themselves. But if we start spreading the word on how we can make change, and that word continues to get spread to other employers and more get on board with this, that's when we'll really have some significant change locally and nationally.
Tena, last minute words of wisdom to us?
I would echo what Dan says. There have been a lot of people involved in helping to make me smarter. And so I owe it to my community and anybody else who needs help to turn around and educate the next person.
Jake?
Yeah, just one last thought. If you do decide to go on this journey, be prepared for a backlog of need for primary care. There are many people that have not been to a primary care physician in decades. And what we experienced our first year, we had 11 cancers detected. The second year we had 7, and those cancers exist whether they get detected or not. And if you catch them early, stage 0 or 1, you know, the outcomes are fantastic. The cost is very reasonable for treatment. But if those go undetected to stage 3, stage 4, the outcomes are much worse and much more expensive. And so that's part of the long-term health outcomes. And you know, that's kind of the noble purpose of providing a clinic.
That is amazing.
That's all I have to say.
You've given us some amazing thoughts today, amazing numbers. I will be back with all of you in the audience later on in August. We want to present the Alliance solution to DPC, to direct primary care. And so I would love to see you again soon. Dan, Tena, Jake, thank you so very much for your time today. And everyone on the webinar, thank you for the privilege of your time as well. Goodbye from me.
Thank you.